Imagine waking up one ordinary morning feeling perfectly fine until the moment you swing your legs out of bed and a sudden, sharp pain grips your lower back, shooting down your leg like an electric current, stopping you in your tracks. And in that instant, something changes. Because pain like this doesn't just hurt physically, it unsettles you psychologically. It makes you question your body, your future, and your independence. And when a scan later shows the word slipped disc, fear quietly takes control, because you're immediately pushed into a world of alarming language, compressed nerves, degeneration, surgery, lifelong damage. Yet, what most people are never told is that back pain is one of the most misunderstood medical conditions in modern healthcare. And the story of a slipped disc is far more nuanced, hopeful, and scientifically interesting than the frightening version most patients receive. Your spine is not a fragile stack of bones waiting to fail. It is a strong, adaptable structure designed for movement, load, and resilience. Made up of vertebrae cushioned by intervertebral discs that absorb shock and distribute forces as you walk, sit, lift, twist, and bend, and each disc contains a tough, fibrous outer ring and a softer gel-like core, which over time can weaken due to aging, prolonged sitting, poor posture, lack of core strength, obesity, smoking, repetitive strain, or sudden overload, allowing the inner material to bulge outward, a process labeled as disc herniation or slip, even though the disc itself doesn't actually slip at all. And the pain most people experience doesn't come from the disc itself, but from the inflammation and irritation of nearby nerves, which is why pain often radiates down the leg rather than staying in the back, creating sciatica-like symptoms, including burning pain, numbness, tingling, or weakness. But here is a crucial truth supported by decades of research in both the USA and the UK. Disc bulges are incredibly common and often completely painless, with large population studies showing that many people with no back pain whatsoever have disc herniations visible on MRI, which means that seeing a disc problem on a scan does not automatically explain your pain. Yet once a scan is shown, fear takes hold, movement stops, muscles tighten, confidence collapses, and pain becomes louder, not quieter, because fear itself amplifies pain through the nervous system, creating a self-perpetuating cycle that turns a temporary injury into a chronic condition. For years, patients were advised to rest, avoid movement, and protect their spine. But modern evidence-based medicine has shown that prolonged rest actually delays healing, weakens stabilizing muscles, stiffens joints, reduces blood flow, and increases pain sensitivity. Which is why current clinical guidelines now emphasize early, safe movement rather than immobilization. Yet many people remain trapped in outdated advice that unintentionally worsens their condition. So what actually works? And why do some people recover fully while others struggle for years? The answer lies in understanding that slipped disc pain is not just a structural issue, it's a combination of tissue irritation, nervous system sensitivity, movement patterns, and lifestyle factors. And the good news is that approximately 80 to 90% of people improve without surgery when these factors are addressed properly, starting with education, because when patients understand that pain does not always equal damage, fear reduces, muscles relax, and movement becomes possible again. Followed by targeted physiotherapy that focuses on restoring mobility, rebuilding core strength, improving posture, and gradually exposing the spine to normal loads, not through random exercises, but through structured, progressive rehabilitation tailored to the individual, because a strong, coordinated core reduces stress on discs and distributes forces more efficiently across the spine. Aerobic activity like walking plays a powerful role as well, improving circulation, reducing inflammation, and retraining the nervous system to interpret movement as safe rather than threatening, while pain relief medications may help temporarily but should be used to facilitate movement rather than replace it, since pills do not correct weakness, stiffness, or fear-based avoidance, and injections may calm inflammation but rarely solve the underlying drivers of pain. Lifestyle changes often produce results comparable to first-line medications, yet are frequently underestimated. Weight loss reduces mechanical load on the spine, smoking cessation improves disc nutrition and healing, optimizing sleep posture reduces nocturnal pain, and managing stress lowers muscle tension and nervous system overactivity, which is critical. Because chronic stress keeps the body locked in a state of threat, where pain signals are amplified and recovery is delayed. Surgery, despite how often it dominates conversations, is reserved for specific scenarios such as progressive neurological weakness, loss of bladder or bowel control, or severe persistent pain that fails to improve after months of appropriate conservative care. And even when surgery is required, it does not fix the spine permanently, but aims to relieve nerve compression, with long-term success still dependent on rehabilitation, movement, and lifestyle adjustments, which is why surgery without behavior change often leads to recurrence. Perhaps the most empowering truth of all is that a slipped disc is usually an episode, not a life sentence. Because discs can heal, inflammation can settle, and the body can adapt remarkably well when given the right conditions. But long-term outcomes depend on what happens after the pain subsides, because returning to inactivity and fear recreates the problem, while building strength, confidence, and movement resilience breaks the cycle entirely. And this is why chronic back pain is rarely just a spine problem. It is a nervous system problem, a movement problem, and a lifestyle problem combined. And when patients stop chasing quick fixes and start understanding the bigger picture, recovery becomes not only possible but sustainable, because the goal is not to eliminate every sensation, but to restore function, confidence, and control. And if you or someone you care about is living with back pain that refuses to go away, remember this: pain thrives on fear and uncertainty, but it weakens in the presence of understanding, movement, and evidence. And if you value clear, honest, science-based medical explanations that cut through myths, reduce anxiety, and help you take charge of your health decisions, then make sure you subscribe to MedLogic. Because this channel exists to replace confusion with clarity and fear with informed confidence every single time.